Congresswoman Donna Edwards from Maryland's 4th District, who's been kind enough to join us. Congresswoman, welcome back to the Young Turks.
Hi, it's great to be with you.
It's great to have you here. Today, Kathleen Sebelius came out and said that we had a bad week in health care reform. Why do you think that is? What went wrong this week?
Well, I think, the White House is still trying to figure out its message in terms of communicating with the American people and to those of us in Congress about what they want to see when this finally comes out. And I think there's still a lot of negotiating to do. And I think we're certainly doing that in Congress. And many of us have tried to make it very clear both to the White House and to our colleagues in the Congress on both the House and Senate side that we believe that at the very minimum a strong, robust public option has to be part of an ultimate plan.
Representative Edwards, if the public option is a must-have for people like you in Congress, what's the room to negotiate? How do you negotiate?
Well, it's interesting because I think what I heard when the President went directly into the American Medical Association, which I thought was very smart, and said, very directly that, that he believes that a public option that, where we have a standard of care that's the same and there's a level playing field and private insurers can compete with the public option, he believes that that will lower costs. I believe it'll lower costs too. And so the room to negotiate is over things like, many of us believe that what we learned out of Medicare Part D is that if we have a public option, it certainly has to start at the same time as the private insurers, because otherwise there's no opportunity for a public plan to kind of catch up to the system. And we've also learned that unless it's really competitive with the same standard of care and continuity of care, that it won't lower costs.
Well, we all agree on that front. My question, Representative Edwards, is, we like to keep it real on the Young Turks. The reality is the Republicans are in the back pocket of the private insurance. So what are you going to negotiate with them? You're not going to negotiate. They're always going to be against the public option. If they agree to a plan, then you know you have a bad plan. And the real negotiation is with your Democratic colleagues in the Senate who also sell out to the corporations from time to time, and possibly on this one. So,
well, I have to tell you, there's no question about it that the real work, the heavy lifting here has to be over on the Senate side. And, I'm on the House side, and I know that what we're going to do in the House is we're going to come out with the strongest bill possible, and I think that there's from our leadership on down, there's a real commitment to a robust public option. I hope that what they do on the Senate side is that the majority leader, says to Democrats, come on, let's step up for the American people. And I think it's really important for people across the country, and especially in some of those problematic states, to make sure that they let their senators know that, just letting the private insurers control the game is really not acceptable.
What I'm curious about, Representative Edwards, is, how does it work? When you go to talk to the Evan Bayes and the Ben Nelsons and the Mary Landrieux of the world, whether you're coming from the House side or if you're a Democrat in the Senate, and I know obviously you're coming from the House side, do you talk to them as if they actually care about the policy? Do we do the charade where we say, oh, no, really, co-ops or not co-ops, et cetera, when you know they're getting paid by the other guys, and that's why they're not in favor of the public option?
Well, I think that to the extent that, those relationships are exposed by those who sit outside of Congress. There was a time I wasn't in Congress, and I believe in, in exposing relationships to show how that is impacting public policy. But I have to tell you, I think from some of those states, and this is, an organizing thing, that from some of those states, it really is going to take their public, their voters, the people that they care about, stepping up and saying, your relationship, whatever it is, with the private insurers and those special interests that want to stop us from having any kind of reform is not acceptable. And I think that that those public voices actually have to, the public has to raise its voice. It's really clear from the polls that people want reform. And so I'm going to start from the standpoint that at a bare minimum, even despite the relationships, when these senators actually hear from their voters, that could be the game changer.
And Are you satisfied so far with how Obama has been, on this? Has he been clear enough? Because, a lot of people are saying he hasn't really put his foot down, and if he appears to be willing to negotiate away a public option, then you can guarantee it. It's bet your bottom dollar they will negotiate away the public option.
Well, I don't want to prejudge that, because I think that there's an absolute strong sentiment in the House of Representatives, frankly, that we will not get a bill through there if we don't have a strong, robust public option that truly is competitive, that isn't just a dumping ground for the sickest patients, and that really will compete and lower costs and invest in things like prevention and getting more doctors trained who are doing primary care and pediatric care and all the things that we've sort of driven out of the system. And when I heard the president's remarks in front of the American Medical Association, I mean he did say, I thought pretty clearly, that he believed that a public option would result in more choice for consumers, more competition, and lower costs. And so I'm going to take the president at his word. And I think that many of us in the House of Representatives, and I hope in the Senate too, are going to belly up to the bar and make sure that if the president is out there saying that he believes a public option will lower costs, then we're going to give him one.
We're talking to Representative Donna Edwards from Maryland's 4th District. So can I take that as a bottom line, red line for the House, saying we will not sign a bill that does not have a public option in it?
Well, I can't speak for the entire House of Representatives. What I can tell you is that this past weekend I held a healthcare forum out in my congressional district, and my district is one of these where we've got a lot of federal employees and a lot of people who have insurance, but their premiums and deductibles are skyrocketing, their co-pays are going up, and families are getting squeezed. And we have an awful lot of seniors who are concerned about their prescription drug costs, which up until now hadn't actually even been part of the conversation. Now, even prescription drugs are part of the conversation. And I heard from hundreds of people in my congressional district saying we really, and understanding clearly that we must have a public option, that has to be a choice, and that when there's that kind of choice, they believe that costs will be lowered. And so I've heard it from my constituents, and I'm voting my constituents. I'm not voting for the insurance industry. I'm not voting for the hospital association. I'm voting for my constituents. Representative
Edwards, of course you don't speak for the entire House, but you are inside the Democratic caucus. And what is your sense of the caucus? Will they insist on the House side on the public option, or is that still negotiable?
Well, we've had a number of conversations in the variety of caucuses. You know that the Tri-Caucus, which is the Black Caucus, the Hispanic Caucus, and the Asian Pacific Islander Caucus, actually came up with a set of ideas and principles for healthcare reform and as did the Progressive Caucus, and a strong public option was part of that. Well, if you add the numbers together of those caucuses, you don't have those in the fold, and you don't have a bill.
All right, that's pretty clear. And let me ask you one last thing. If it somehow a bill does pass through without a public option, and Barack Obama declares victory, hey, we got health care reform. Yeah, we didn't get the public option, but we got health care reform overall. Is it a sham?
Well, I think it will. I think it will be, doggone near impossible to define reform as real reform, as lasting reform for the American people if it doesn't have a public option. And I'm coming from a standpoint where I actually believe that we ought to have a single-payer health care system. And I think it's been very unfortunate that, in some ways that has been taken, out of the game and off of the table. As a result, we are here, scratching and clawing for a strong and robust public option. And I'm willing to do that, but it must be strong, it must be robust, it must cover everybody, and it must cover prevention, and it's got to be competitive.
And so, bottom line, given the caucuses you're in, if it doesn't have a public option, it's not making it out of the House.
Well, again, this member of Congress understands really clearly from her constituency, and I do understand that from my constituents, that a public option, a robust, and not just any public option that just captures a bunch of sick people, but a robust public option that's really competitive has to be in the bill in order for me to be able to support it.
All right, Congresswoman Donna Edwards from Maryland's 4th District. We really appreciate you joining us on the Young Turks.
Thank you too. Stay in touch.